Cervical cancer kills up to 10,000 women per annum, while breast cancer affects 1 to 2 in 25 Nigerian women. Majority of women dying from breast and cervical cancer present themselves to doctors when the disease is already at an advanced stage, when little or nothing could be done to improve the outcome. If only women attend regular cancer screenings, then these deaths would have been avoided. Awareness levels about cancer screening and prevention are very low. Most women think that the screening tests are also very expensive. Some also believe that they are protected by religion and do not accept the reality of cancer. Optimal Cancer Care Foundation is a registered non-governmental organization dedicated to raising awareness about preventable cancers like breast cancer, cervical cancer, and prostate cancer. Led by Dr. Femi Olaleye, the foundation also offers cancer screening services to the Nigerian public. Since inception in 2013, the Optimal Cancer Care Foundation, in partnership with organizations, has been at the fore of cancer awareness, treatment and prevention in Nigeria. The foundation has screened over 30,000 women, averaging 10,000 women annually. In over 200 outreaches, organized in partnership with mostly faith-based organizations, thousands of women have benefited from free cancer screening services and subsidized treatments for those identified through the campaigns.
The role of what we expect doctors like Dr. Anansi to do is to help further the message of cancer prevention. We run a cancer screening service out of 2 locations in Lagos, Bode Thomas and Alagbado, and we go to outreaches in churches, faith-based organizations, and outside Lagos. But what Dr. Anansi has done here at Godfrey Hospital is one of the very first kind of partnership that we want to see other doctors are doing with us. The evidence has stacked up against medical practitioners that we doctors don't offer our women this screening service enough. And that's the reason why a lot of you don't respond. And I can see the response today. The response today has shown that if a doctor is offering it, women will respond. And more importantly, she's been very kind enough to put an icing on the cake. She's made it free. Only government can do anything really for free. So we expect that with time when she starts adding cost to this service, more women will be able to afford to do that. So thank you very much.
Dr. Anansi Chinenye, I'm the medical director of Godfrey Hospital. I'm equally a pediatrician, consultant pediatrician. Why do I decide to do this screening for my women in my environment? One, because cancer is becoming very, very common, especially cervical cancer, breast cancer too. And not just that, we just had a screening in my church where out of 57 women that were screened, 10 were positive. So I asked myself, if it's this common, what am I doing? What do I offer to the society? What do I offer my fellow women to keep them alive, for them to be able to take care of the children that I love seeing as a pediatrician? People should go for screening, especially women. Screen doesn't mean that you're positive already. It means that they are seeing a sign that there must be something abnormal there. So when you go and see what is abnormal there, what do? You start the treatment on time, like the cryotherapy that we've learned today, which cuts off that early stage. So we are telling the whole people today, my public health message is that go for the screening. If you're asked to come back in 6 months, come back in 6 months. If you're asked to come back in 2 years, come back in 2 years. Prevention is better than curing cancer. Thank you so much.
One of of the reasons why I like doing seminars like this, particularly for a group of women like you, is simply because they said that if you want to educate an individual, teach a man. But if you want to educate a society, who should we teach? Women. Yes, we should teach women. So women are the bedrock of society, and we recognize that if we can teach our women something or the other about preventing cancer, it will make the job of doctors easier. Because prevention, they say, is better than cure. So the message here is that this cancer does not respect religion, does not respect whether you're a Muslim or a Christian. Everybody should do cancer screening. Women, what causes cervical cancer? The virus is called HPV. How do you get HPV? From men, through sex. So a virgin cannot have cervical cancer. Summary of the presentation is that vaccination can start from what age?
10 years.
10 years. So if you have a daughter, before she becomes sexually active, it's important to get her vaccinated.
Mo wá láti Manitu, mo ń ṣiṣẹ́ ní Manitu Health Center. Ètò tí dókítà wa gbé kalẹ̀ fún wa lẹ́nu ètò tó dání. Àwa obìnrin gbogbo ló ṣe é fún táwọn náà bá rí ètò báyìí. Káwọn náà tètè máa kára máa ti díẹ̀ láti ṣe. Káwọn náà máa wá láti ṣe, kán bá gbọ́, kán máa gbìyànjú láti ṣe. Nítorí fáǹfààní ara wa ni.
This program is very good, raising the awareness. Because the problem we actually have is people knowing what is really the meaning of cancer. A lot of people have this fear of, I think I have a friend with me here who has been mostly in fear of maybe she don't know when, maybe they're going to tell her she has cancer. But I'm happy that I was able to convince her that it's not painful, it's not harmful. It's something you will just go through, and the earlier you detect it, the earlier the better. It's curable, it's preventable. My advice to the women out there is for them to go for the test, go for the screening, and to prevent it before it's bad.
We're quite happy to be here at Godfrey Hospital in the middle of Amuwo, partnering with Dr. Ananti, a consultant pediatrician, who is very keen to offer this service to women. We encourage other medical practitioners out there that run medical services or healthcare services to partner with the foundation and outsource their cancer screening service with us so that we can continue to fight this war against all the frontiers that are out there. Now, moving forward from a national level, we expect that cancer screening service will be made free to women across Nigeria. And this is one of the first things we want to establish, that if we in the community, private practice, can deliver services like this, there's no reason why government cannot pick it up as well. All in all, I thank Dr. Chinenye Ananti for having us here in Godfrey Hospital for today's exercise.
We are raising awareness and reaching women where they are. The screening test detects abnormalities very early, at a stage when doctors can improve the outcome of the disease and save the lives of the women. We have made a commitment to offer heavily subsidized and sometimes free cancer screening in order to encourage women to embrace cancer screening. We also offer vaccinations against HPV for young girls and women. Vaccination starts from 10 years up to 65 years. Because early detection is the key to winning the war against cancer, we are taking concrete steps to make cancer screening services available to more Nigerian women. Our new Cancer Care Center at Alagbado commenced operations in 2015. It is our vision to have one center in every local government in the country. Women, regardless of their religious or social-cultural backgrounds, can be affected with cancer. Early detection is key. Come for screening today. Visit us at the Optimal Cancer Care Foundation. We offer free cancer screening services every Friday at 2 centers, located at 118 Bode Thomas Street in Surulere and 2 Ajite Aderu Close off AIT Road, Bakari Bus Stop in Alagbado. Join the war against cancer by supporting our free screenings and subsidized treatment through your donations. Partner with us to take the campaign to women in your community, church, or neighborhood. Partner with us to expand and open more cancer care centers across local governments in Nigeria. Nigerians, arise and say no to cancer. Early detection is key.